Hi everyone, welcome back to our channel. I'm Dr. Amel from City Skin Clinic, and today I thought I'd discuss with you guys maskne. This is a massive problem that we're seeing a lot now that we're sort of a year into this pandemic, and it's really a condition that a lot of my patients contact me and ask for tips about, and I've seen a lot of similar questions on social media. So before we get started, if you haven't already, please subscribe to our channel, and don't forget to check out the rest of our videos about getting flawless skin, and we've got lots of tips and hints to help you with skincare and fill in for Botox and fillers if that's something that you do get during lockdown, because at the moment we're all in lockdown, and in the UK anyway, it's not possible to get these treatments. So maskne is basically a cute little term for acne that's been associated with wearing a face mask. You think of it when we, a lot of us are wearing face masks if you're, or should be anyway, if you're outside, if you're at work, anywhere that's a sort of public setting, or even a private setting. If you're not with people who are immediately living with you, then usually it's a really important idea to wear a face mask. So face masks are not optional, but the maskne that comes with them for some people doesn't have to also be non-optional. Maskne really happens because with face masks, and you get a few things happening. So because you're breathing warm air, you end up with this humid, moist environment, and that's perfect for a couple of things. One, for skin to kind of start to break a little bit and get irritated. It's a condition called dermatitis, and where you get sort of peeling of the skin. You might get sores, you might get redness, and if you have rosacea, it might also be triggered by this. The other thing is this humid environment is perfect for bacteria. So bacteria that's normally on your skin might overgrow, and then you might get, as well as dermatitis, you might also start getting breakouts and acne, hence the term maskne. Other things that can happen with face masks is if you're wearing them and it's exceptionally tight. So you should be wearing a mask so that it forms a nice seal, but if it's too tight, it may be digging into the skin, and that may also be causing areas of sores. So the thing to do to help improve maskne and get rid of it, there are a few things you can do. Number one is make sure firstly that you're regularly washing your face mask if it's a reusable one, and when you wash it, you might want to try using a detergent for sensitive skin, because your skin will be quite sensitized during this time. Always make sure that your mask is completely dry before you wear it, because again, if the mask is damp, you're contributing to that really humid environment where bacteria and inflammation can really thrive. The other thing with maskne that I encourage people to do, unless you're allergic, is to start using a salicylic acid toner. This is really helpful in terms of the acne and the breakouts, and you can start gently with that. If you have massive sores, of course, avoid those areas, but for pimples, salicylic acid toner used once a day is really good, and look for a 2% salicylic acid toner. The other thing to do is when you get home, when you take off your mask, so the first thing you should do is wash your face, and you might want to use a gentle and hydrating cleanser to do this. Nothing that is active or irritating to the skin. So thoroughly wash your face, then allow it to completely dry before putting anything else on it. Once it's completely dry, you can then put a nice lightweight moisturizer just to keep it hydrated. I know that I always love the idea of almost everyone being on retinol or tretinoin for skin, but if you're on these products, if you're having an acute flare-up of your maskne, you'll stop using them until you get the irritation under control. You might also, if you're using a regular AHA, so an alpha hydroxy acid, like a glycolic toner, Again, put that on hold until your skin heals up, especially if you have things like sores. So stick with the salicylic acid toner, a nice lightweight hydrating moisturizer to keep your skin protected. And then during the day, what you might want to do is, again, when you put before you put your mask on in the morning, wash your face, make sure it's fully dried, and then put a thicker moisturizer on, something that's non-comedogenic, but it'll help create a barrier between your skin and the moisture. And I know this is a little bit yucky, but if you think of maskne, it's a similar process to nappy rash. So nappy rash happens when, because of all the, I won't go into detail, but because of all of the heat and the moisture in that environment in the nappy, and that causes that skin irritation. So if you think of maskne as being similar to that process, then using a barrier cream, even creams for nappy rash, if you can get a hold of them from a chemist, there's quite a lot and you can easily get them, that will help, especially if the irritation is quite severe. It'll be soothing and comforting, and it will also protect the skin and form a barrier. I get asked whether it's okay to wear makeup and if that's going to make under your mask, or if that's going to make maskne worse. To be honest, makeup shouldn't make it worse. Obviously, if your skin's very irritated, you want to put as little on it as possible, but if you do need to wear makeup, that's not a problem. Just make sure that you keep it to something lightweight. So perhaps use a very light foundation if you wear it. Perhaps use something that has some zinc in it. Maybe you might want to try powder rather than liquid. Try something that's oil-free as well. So, really, or a tinted moisturizer if you can get away with it. These are just will help with this process. And if you, if you're getting kind of sores and digging where your mask is, then you might want to look to see if it's too tight, or maybe there are some sort of hydrogel patches that can protect the skin, or plasters over the areas that are irritated, so that you're not making this process worse. In the long term, and the reason it's important to kind of really get the maskne under control is you don't want to end up with the side effects associated with having that chronic inflammation and breakouts, things like hyperpigmentation, because these do need, and acne scarring, because these will need more involved treatment. If you are at a stage where you are getting this, then start to treat it like acne, and that may involve looking at things like benzoyl peroxide, perhaps even considering later on, once the initial irritation has settled down, and let's say you have hyperpigmentation or some skin texture problems afterwards, then looking to reintroduce your alpha hydroxy acid, looking to reintroduce your retinol or your tretinoin, definitely also vitamin C. So these will help for that second stage, but in the initial stage you want to irritate your skin as little as possible, and you want to protect it from both the inflammation and the bacteria, and as well as kind of that very moist environment, which isn't so great for the skin. So there is light at the end of the tunnel. I hope you found this video useful. We've got another video on acne and treatments for that. If you're interested, I've put a link to it. I've also put a link to our acne blog post, which has a bit more information about how to treat maskne. Let me know if you have any questions about maskne or acne or any other skin problems associated with face masks. Don't forget to give this video a thumbs up and subscribe to our channel if you haven't already done it. Until next time.